Great. So look, we've got a real case here. We've got someone that's got Achilles tendinopathy or tendinosis. Had Sever's disease and Osgood-Schlatter's when he was a child. Both of those are kind of, they used to call them growing pains, but basically one is a heel pain and one is a knee pain. And we've got shortened Achilles tendons on both sides. He's changed his running shoes recently, started to get a lot of stiffness and pain, and his whole foot goes numb after running for like a few hundred meters. So what we're going to do is look at this. Now remember, the Achilles tendon is really the end point of the gastrocnemius. So when we're talking about Achilles tendinopathy, really we're talking about the gastrocs. Remember again, the trigger points live somewhere mostly in the belly of the muscle. So we're going to look at the medial and the lateral gastrocnemius. They're kind of two functional units that blend together. And then we're going to have a look down at the Achilles tendon itself, and we're going to look at a tendinous trigger point, which is pretty cool. Great, so let's crack on and treat him. So we're going to start with a deep stroking massage technique, remembering the trigger points are somewhere in the belly of the muscle. So with the deep stroking massage technique, look, it's all about the depth. I'm feeling everything I'm doing, and if you can visualize the tissues as well, that's fantastic. As we come down, we can feel that shortened lateral head, and as we do the deep stroking massage, bang, we can feel here's a trigger point here. So we're just going to hold inside that taut band and wait for a change.
A question here, which is, if it hurts lower down, why are we treating here? Remember that the Achilles is the lower part, the tendon of the gastrocnemius. So let's look for these trigger points here. If the trigger points make the host muscle inefficient, they make it shorter, they make it fatter, and they're going to pull on that Achilles tendon as well. So we're just going to work here, both sides, looking for those taut bands, pausing if we find one. There's one. Beautiful. We're going to look at the medial side. There's a trigger point. Now hold and wait for a change. Very strong muscles, don't forget, take a while to hold. Remember the cardinal sin, coming your way too quickly. Pause, hold, wait for that change. Good. I'm going to follow that with a little bit of some effleurage, just downward stroking only. Remember when we looked at the plantar fasciitis, we did the opposite way. Today with the Achilles tendon, we're going downwards. So where do we go from here? We've worked on his gastrocs medial and laterally. So I'm going to put my hand under his, just a cup under his ankle. There are three areas where we get kind of Achilles tendon problems. One is sort of intramuscular, just above the tendon. One is where the muscle and the tendon join, the muscular tendon junction. And the other is down in the tendino-osseous junction, down at the blending of the tendon with the bone. So as we come down, we're going to look for those three zones. And we had a little feel before, and we found that the muscular tendinous junction here is the area where he's feeling the symptoms. So let's see if we can recreate that symptom picture. How's that there? Getting close to it?
It's painful.
Is that the pain?
Yeah.
There.
It's much harsher than it is usually.
So it's the same pain but much deeper.
Yes.
So remember, it's great. So we're able to reproduce the pain. I can actually feel that area of the tendon where the problem is. So what are we going to do? Identify the trigger point that's causing the pain. We're going to come down and we're going to hold and wait for a change. Now, what I'm really trying to do is to match the pressure within the tendon itself. So I'm going to it's almost like a piggyback. I'm going to hold it and wait for a little dance with it, wait for it to let go a little bit more, come away a little bit more, go a little bit more. All the time really propriocepting, feeling, waiting for that change. But we can stay here for really up to 5 or 6 minutes. So the other area that we get often with Achilles tendinopathies is the attachment trigger point. So while I'm there, we're just going to look here. Usually what happens is we start to get to around about 2 to 3 inch and a half above the ankle. We start to feel a kind of roughening of the Achilles. Remember, the Achilles is a really big tendon. It's one of the few tendons that has also deep pain receptors. Apparently there are 3 areas in the body with deep pain receptors: the teeth, the Achilles, and the testicles. Okay, and here we go. Here's the attachment trigger point. So it's an attachment trigger point on the calcaneus itself, right at the back. And what we're going to do is this, we're going to find the attachment trigger point, we're going to drive it down. So we're going to follow the deep stroking massage now with a little stretch through the Achilles. It's just nice to lean in a little bit, especially if you're as large as I am. So I want you with your toes to push me away, like that. And we're going to hold it for about 30% of your power for about 5 seconds, okay? So push me away. That's it. 5, 4, 3, 2, 1, and relax, and relax, and relax. And we can deepen the stretch that way.